What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Dr. Bryan Brozy, physical therapist. I'm here with my friend and naturopathic doctor, Keoni Teta. Keoni, how are you today?
I'm doing wonderful. I'm looking forward to this one because I treat golfer's elbow quite a bit. So I'm really looking forward to what you have to say on it. It's nice to be back. Podcast's been a while,
Yeah,
right?
yeah, absolutely.
Has it been? It's been about a year or so, right? Or
Just about, just
yeah,
about.
right. So hopefully we can be a little bit more consistent than that. But this is great. I'm looking forward to this one because I see it a lot.
Yeah, so like you alluded to, Keoni, we're going to talk about golfer's elbow here. And in general, kind of what golfer's elbow is, just to start, it's a tendinopathy, right? So tendinitis, tendinosis, people are really common or commonly hear like tendinitis and things like that, so they know what that is. In terms of golfer's elbow versus tennis elbow, because I kind of hear those things interchanged and they are two different things. So golfer's elbow is going to be more of the tissues on the inside portion of your elbow. So like if you're holding your palm out, palm facing forward, the inside portion is going to kind of rub up against your trunk. That's going to be more
Right.
golfer's elbow. That outside lateral portion is going to be more of like the tennis elbow. But in general, kind of what's happening here, or what's happening with these tissues, and what is this issue? So you have a group of tendons that start at those epicondyles, which is just kind of like a bony prominence on the upper arm bone that these muscles attach to. And those tendons, for golfer's elbow specifically, we're talking about the common flexor tendons. So that's like flexor carpi ulnaris, flexor carpi radialis, a couple other muscles, but really it's not super important. We're just talking about the location and what's happening there. So we're talking about a common flexor group. So with that, that means it's going to flex your wrist. It's going to kind of flex your elbow a little bit, but we're
Right.
primarily talking some wrist movements here. And if you think about a golf swing, you can kind of see how most people could start to develop some discomfort or really at least highly demand the tissues in that medial epicondyle there. When people come to you, Keone, when are they coming to you in this life cycle? Are they coming to you, they've been dealing with this for a month and a half? This is something new all of a sudden. Kind of what do you typically see when they
It,
do come? What are they reporting?
it,
Who are they?
so typically it is golfers, right? It's also people who work out, but typically it's already chronic. They're not coming in right away. They've
Yeah.
been dealing with the pain for a few months to sometimes up to a year, and it's just not getting better.
Yeah. Yeah. And that's commonly how I see it too. They come to me when it's not getting better. Some of those things that you may be dealing with when you have golfer's elbow or like pain, tenderness, usually at that site of that epicondyle. So again, I'm talking right above the elbow, and I'll get a little bit more into kind of where they attach maybe a little bit later, but it's important to know that they do attach above the elbow because some of the things I'm going to tell you later on about how to kind of treat it, you want to treat the whole tissue. So you want to know, you want to get above the elbow. These muscles attach above or these tendons attach above the elbow, and then that tendon blends into the muscle belly, and that muscle belly turns into another tendon as it attaches to some part of the hand, wrist, or whatever the case may be. So just to clarify there too, because I see some confusion there as well in terms of what a tendon is. A tendon is kind of that bridge gap. It attaches the muscle to the bone, and it's that transition zone between like the muscle belly, which has a different physiology to it than the tendon necessarily. And we're kind of in that bridge pattern. And they do tend to get the most damage to muscles in a tendon because you kind of have that area where it's what they call it the musculotendinous junction. And it's like where you're getting that really high level of blending from the physiology of a and the way the cells look of a muscle belly versus a tendon. There's some ways that it changes slightly. But important to know where it attaches to and kind of what you're seeing. So like you said, Keone, they'll come in. Typically, they've been doing it for a while, and we'll talk about why it may be more common in golfers. But those symptoms being pain, tenderness, that pain can be at the site above the elbow. It can be a little bit below the elbow. I've also seen it where people really tell me along the ulnar border, which would be like your forearm bone that you kind of rest your forearm down on. And they can
Right.
explain the pain kind of in like that mid zone. The pain can increase or decrease with like wrist or elbow flexion and movements that involve the wrist, and any sort of loading. And then really commonly what I see is like someone will golf and then they'll be trying to go to the gym and they're like, man, I just can't grip this 45-pound dumbbell anymore. It hurts like crap when I try and
Yeah.
grip the
Yeah. I see
dumbbell.
that quite a bit.
Yeah. So those are some of the common symptoms as far as like the signs you may see of it: pain, swelling, inflammation. You may have some redness. You may be limited in that range of motion, like I was saying, particularly in like straightening the elbow and getting the wrist involved with some of those movements. But kind of what is it and what's happening there? What is a tendinitis, a tendinosis, or a tendinopathy? And all these are kind of interchangeable words to some degree. But in short, it's really important to know in that the musculoskeletal tendinous junction, as you're blending from the muscle to the tendon, the collagen, the cells start to change in their alignment, and in that tendon, they become really organized and linear. So they're you can picture it like diving into the bone, kind of like you would picture like an anchor rope for a boat and how it's kind of holding it in place. This is kind of what those collagen fibers and some of the cells of that tendon are doing. And most commonly, when people get a tendinitis or some sort of tendon issue, is those cells are becoming really unorganized. So as opposed to, like my fingers here are just a straight linear path, now we're getting this kind of haphazard disorganization of those cells. That's going to increase like the water content in the cells, the proteoglycans, which drive in water and all these different things that can bring in swelling, water, make it painful, make it limited, make it red, and all that stuff. And so what happens typically, and I'm just going to use a golfer example because this is most commonly how I do see this, is like a golfer will take like a chip shot, which is like a smaller shot, and they'll hit the ground and kind of chunk it. So the club dives into the ground, and all that force goes straight up through their elbow from catching the ground like that on that contact. It'll hurt in the moment, and they'll feel this like radiating up along kind of that ulnar border that I was talking about. That's really uncomfortable. Maybe they're able to finish their 18 holes or whatnot. Probably more often than not, they typically do. And then we don't do anything about it. Maybe we take some ibuprofen that night, and then we keep golfing, we keep lifting, we keep grabbing objects, even so much as like turning a doorknob. I just got done with a patient who had what I would classify as golfer's elbow, and he was really having a lot of difficulty like helping his parents like pick like a water, a 24 pack of water
Right.
bottles up, and having a lot of pain with that. Um, so in terms of what's happening there and kind of what we want to do about it with the I lost my train of thought in terms of the tendinopathy or where I was, Keoni. Oh yeah, in terms of how it comes about. So they chunk that
Yeah.
shot and they get that force, that eccentric load that goes through the forearm and through the club, and it can damage the tissue and kind of start this dysregulation and disorganization of the fibers. And like I was saying, they go home, they take some ibuprofen, maybe they favor the arm for a little bit, but they don't do anything to start realigning those collagen fibers and get the tendon back in an organized way. And that's why typically I see people, like you mentioned, deal with this for 2 or 3 months, and then they come to me. And then typically in 6 to 8 weeks, we're able to really clear it up. But it does take some time. But that is typically what I see. And part of that is you're getting that force going straight up through that arm and that tissue. And then we talked about how what's happening is the tendon is getting disorganized within the cells. So if you
Yeah.
don't do the right thing to organize it, you're going to be stuck in this tendinitis, tendinosis, tendinopathy. And tendinitis is kind of that active inflammation. So that would be the golfer
Mm-hmm.
within the 48 hours of when I said he kind of chunked his shot. And then what
Right.
typically happens, and I saw this even in the patient I was just referring to, he was 19 years old. And I told him, I think you have a degenerative tendinosis, which at that point it goes from being a tendinitis, it's painful. Maybe you modify your activity, you don't play as much, you try not to use that arm, whatever the case may be. And then you try 2 or 3 weeks and you think you're feeling a little bit better. So you go back to the golf course. It's in
Mm-hmm.
pain again. You kind of flare up that tendinitis again, and then we repeat cycle of not necessarily doing much about it except for kind of
Right.
quelling the use and soothing it a little bit. And we end up in this pattern where now you've got all that disorganization, and what happens is the tissue starts to degenerate. It's really thickened, it's really imbibed with fluid. It's really swollen. So it's not able to work how it should. And you start to get a degeneration of that tendon. It's going to make it weaker. It's going to make it less resilient to tensile loads, or kind of that chunking shot that I was referring to. And then
Yeah,
you
and
end
you
up in
do.
a real bad spot.
Yeah, and you do feel the weakness with it,
Yeah.
with any of it, right? When it becomes a tendinopathy, whether it's in your shoulder, elbow, or anything, you do start getting weakness, and it feels like muscle weakness.
Yeah. And
But
that's typically people typically flow through that kind of life cycle. Is you get the tendinitis, you get an immediate injury, and then you favor it, but you don't necessarily know that, hey, these tissues are getting really disorganized, and I don't know how to reorganize them. And so you're not addressing the root problem. You're just taking away the injury insult, the insulting thing.
yeah,
And we're never getting to a point where you're truly solving it.
it's interesting because you talk. I always had this picture in my mind that it came about from the swing, the follow through of
Hmm.
like a long drive,
Yeah.
like kind of whipping the elbow. But you're talking about like chunking the ground. Is that
Yes.
what brings it on?
That's typically what I see more so now.
Wow.
Anything could bring it on, right? Any load that you're not necessarily prepared for, the body's not necessarily
Okay.
ready to deal with that demand could happen. But in
Yeah.
terms of the golfers, I see it most typically because they do, if anything, chunk their shot, which means they hit it short and they dive into the ground with the club. And that's
Right.
such force. You stop that club, you're swinging as hard as you could, and you hit the ground at max capacity, and that force goes straight up through your elbow.
Yeah.
Now,
So
I've
you're definitely
definitely seen what you're
if you
talking
do
about with
that, you
the
can
takeaway.
feel it. Yeah, right. If you do that, you're gonna feel it. I mean, you're gonna feel it pretty intensely. I would imagine after a while.
Yeah, yeah. And just to give a kind of an example of like how the treatment's gone, or like the life cycle, kind of like I was asking you about, in terms of how do people come to you, or where are they typically at? Like I mentioned, yeah, you may chunk the ground, you have that immediate injury, just like you were saying, where you're getting that immediate pain and you're feeling it. And you favor it, you take off for a week or two, and then, like I said, they kind of end up in this pattern where if you're not reorganizing the tissue, you're always playing this game of let me wait, let me soothe this thing out, and then let me try and get back to activity. And the tendon's
Right.
never ready for that, and you end up with a degenerative tendon.
So we're gonna talk about treatment. You're gonna talk about treatment, but it is interesting because there's this like cultural mindset about like this. It's this whole walk it off thing, right?
Yeah,
Especially with men, I think they're not. I'm talking about myself here too. It's like, all right, you have an injury, you just think it's going to go away, but if you keep doing it, for me, the example for me is like shoulder impingement stuff with like pull-ups and presses over the head. But if you keep trying to do this repetitive thing where you take a break here and there, you take anti-inflammatories, it may seem to get better, but it never really does get better until you treat it appropriately.
yeah, yeah. And it's the same thing for that shoulder impingement, right? Like I would argue, yeah, definitely if you're doing pull-ups and shoulder presses and stuff and you're getting shoulder pain, something to be mindful of and dial it back. But with the right rotator cuff strengthening, you should get to a point where you're not able to do that and you can do the activity fully,
Yeah.
and still aren't limited. But knowing that, one, letting pain be your guide, and then knowing that you really want to get back into activity in a short, progressive, stepwise manner. So, like an example, for instance, that 19-year-old that I'm talking about, he was playing a lot of pickleball, and that's kind of how this developed. And I mean, he went from playing no pickleball to like now I play pickleball 4 to 6 hours a day with my friends. We're off for the summer, all this kind of stuff. Got
Yeah.
to the point where he couldn't use the elbow. And him walking me through his life cycle was like a month-long period of, yeah, my elbow kind of hurt when I was playing. So I took it easy for a day or two. Then I went back to playing. It was okay. It kind of hurt. And you're just always kind of picking the scab of this injury and never
Right.
letting it heal. And like you mentioned, if you're not doing the right educated treatment for it, you may end up just spinning your wheels.
Well, and if you're not doing the right treatment, are you going to actually damage the joint at some point, right?
Yeah, so you could damage the joint, right? So what's happening here is there's a issue with the tendon specifically. In theory, the joint should not be super bothered by this issue. But that said, if you have limited movement, you have pain, it's going to change how you're moving, which could change the biomechanics of the joint and thus change, maybe a chronic issue down the line or more joint stress and force that could lead to arthritis or something like that later down the line. It is important to know if you're doing something that's painful, you are picking that scab, right? I mean, you can think
Right.
of it as like a scab on your skin. And if you play pickleball one day and you have the injury happen, and 5 days later you go and you bring out a maybe not the same level of pain. Let's say the first day you had it, it was a 6 out of 10. And when you go play again, it's a 4 out of 10. That does feel better, but you're still picking that scab. And it's really important. And it's kind of what you alluded to with walking it off.
Yeah.
You want to do the right things. And I do think with a lot of people in terms of walking it off, some people can almost take that to the walking off too literal and the needing to rest too literal. And at the end of the day, we need the right healthy dose of everything.
Yeah.
And with this specifically, you need to let pain be your guide in terms of activity. And then you need to not seek out pain when you start getting back to activity. So like the pickleball patient, I specifically gave them like, hey, today you're going to play for 20 minutes. The 2 days from now, you're going to play for 40 minutes. 2 days from there, you're going to play for 60 minutes. And then if we get to a point where it's no pain, let's play however long you want and see how it feels after that. But you really just being really mindful. And so an example for golfers is like a typical golf course is 18 holes, right? So they'll play
Yeah.
18 holes. So you don't go play 18 holes the first time you're finally coming back. Let's play nine, or let's go to the range and just do, 40, 50 golf balls, golf swings, and then let's play nine, and then let's play 18, and let's really be stepwise progressive with how we're going about this.
Right. And I mean, I guess it's okay to have a little bit of discomfort when you're playing.
Yeah, so you're gonna have some discomfort. What I like to tell people in terms of the exercise specifically, and as it relates to discomfort, and maybe if you are playing and trying to play through it, and I'm just gonna put some hypothetical numbers on it just so we can have a concept
Okay.
for it. But let's say you're in 5 out of 10 pain, right?
Right.
As you're doing some of the exercises that I'm going to talk about, that five may go up to a six. That's cool. Okay. We're demanding of the muscle. We understand that we're pumping blood into there. We may get some more achiness. We may get some more uncomfortable sensations. What we
Right.
shouldn't have happen is that five goes from a 5 to an 8, and that pain feels even more significantly intense. And it's the same exact pain you came in for, as opposed to like this work and burn that you may feel when you're at the gym or demanding of a muscle type feeling. So for me, it's really important that people are aware that you may, even with the treatment, feel a small increase in discomfort. Shouldn't be the pain you came in for necessarily. And then we should really be able to dial that back. And in my experience, and we'll get to this with the treatment, but in my experience, the manual therapy, self tissue massage, working with a percussion gun, a massage gun, dry needling, all these things are super beneficial um, for a golfer's elbow specifically. And this is one of the things we're speaking just with that example of the pickleball player.
Yeah.
I would have him do swings when he first arrived, and he'd be like, all right, cool. This is a 6 out of 10 pain right now. We would do treatment. I would manually work on the tissue. I would have him do a few exercises to align the collagen, align the fibers that I was kind of talking about. I may do a little bit more manual treatment, and I would have him do the same exact thing. Let's test that pickleball swing. And 10 out of 10 times, if it was a five, the next time it was like a three when we tried and tested it out after the manual treatment. And you can kind of play with that and make sure this is all fitting what you're feeling and it's responding this way to kind of, further assess if this is your scenario, golfer's elbow.
Yeah. Let's talk about treatment then, because I mean, this can fit so many things, right? We're not just
Yeah.
talking about golfer's elbow. Talk
Yeah.
anytime you have like a tendinitis that's turning into tendinosis.
So, like we mentioned, the disorganization is primarily what's happening here. What is the issue? So, how do we reorganize the fibers? How do we make sure we're doing this in an appropriate way? And it's important to know muscle contraction, right? We have concentric, which is like the muscle shortening. So if we take a
Right.
pull up and we think about my bicep, as I'm pulling up, my bicep's getting shorter. As I'm holding above the bar, I'm in isometric contraction. My muscles are
Hmm.
working, but they're not changing length. I'm not getting
Right.
longer or shorter within the muscle. And then that eccentric portion, if I was doing the pull-up, I'm coming down from the bar. Now it's under load. I'm controlling it, and that's important to know with the eccentric portion. And with eccentric muscle action, that's when you get the most opportunity to kind of organize those fibers and make everything really taut and help decrease that disorganization, that extracellular fluid that is lying around that tendon, and you get to start pumping and truly aligning that collagen correctly. So the number one thing for any tendinopathy in general is going to be the soft tissues work that you can do by yourself, and
Yeah.
specifically eccentric muscle action, which is for the elbow specifically. If you're on video, you can see it. I'm going to let my elbow start in full extension, and I'm letting my wrist start in full extension. So I'm in the exact
Hmm.
opposite of what these muscles do. Again, flexor, the common flexor tendons, they all flex the elbow or flex the wrist. And we're going to start maximally stretched out. And then we're going to use some sort of resistance, and we're going to fully go through that range of that flexion for what these muscles do. So we're going to flex the wrist, we're going to flex the elbow, and then we're going to go real slow and deliberate through the lengthening portion. And that's our
Okay.
opportunity to kind of demand that tendon and get those collagen fibers to operate in the way that they should and be nice and organized. Nothing more important than this, and that shows more in the research and that I've seen clinically, than this eccentric muscle strengthening.
So with somebody going to the gym, just working out, doing an upper body workout, they should
Yeah.
concentrate on the eccentric phase, the
Yeah.
lengthening,
Yeah,
okay,
and,
of
and
the muscle.
specifically if you're listening to this and maybe you have golfer's elbow, it is not enough to go to the gym and say, "Hey, I'm going to do my normal workout and I'm going to focus on the eccentric stuff." We have got to take the specific tissues I mentioned, flexor carpi radialis, flexor carpi ulnaris, the common flexor tendon, and we have got to line it up perfectly, and we have got to eccentrically load it, and we have got to go through full contraction, full AROM, and fully go back out through that eccentric portion. And we have to do that in the first phase. So when I typically see people, when I started seeing the pickleball player in the first week or two, we were doing
Okay.
high reps, low load of that. So we're trying to get as much blood flow, as much opportunity to reorganize that collagen fiber as much as we can with as little demand as possible. So I'm talking 20, 30 reps with no weight, or like the lightest band I have in my clinic. 4, 5, 6 weeks into treatment, we started
Hmm.
adding a lot of weight and took a dumbbell, inverted it. So now he has like that biomechanical challenge of a dumbbell's got the weight on two ends, and we made one end really long. So it's a lot of load that goes through that tendon. And he went down to doing like 3 rounds of 8, and we really started strength training it. So that gives you an idea of like the rep range. And in the beginning, your main goal is to get as much blood flow to it as possible, as much of these eccentric load type contractions as you can without paying for it later and feeling like you're increasing your pain. So all
Yeah.
that within what fits your scenario.
Okay. So yeah, and when you're doing the high rep where you're initially trying to line things up, are you doing how many sets? Are you doing 10, 20 minutes? Like is there a time
Yeah.
constraint?
So first and foremost, pain's going to be our guide, right? So
Right.
if I sit down with someone, it's the first time I'm treating them, and I say we're going to do 20 of these, and at 15, they're losing quality, they're feeling more pain, we're not able to hold and perform the exercise like is absolutely perfect, we're just
Yeah.
going to do 15, or we're just going to do the number that we can do perfectly. In terms of
Okay.
like general rep ranges, as much blood flow as you can get is going to be like that 20 to 30 kind of range. You're going to feel an intense, like that work, a pump kind of feeling, like you're really
Yeah.
getting that blood flow to there. And you want that high level of repetition there as much as you can, and then space it out throughout the day. And this is again where pain is going to be your guide. So for the pickleball player specifically, I had him do 3 sets of 20 a day at the very
Okay.
beginning. And that
Okay.
was like, hey, we're not going to do all three of 20 of these at one time. You're going to do like a breakfast, lunch, and dinner and do 20 each go. And just so we can get this tissue as organized as possible, as frequently as possible. So you kind of see how we're playing more of a
Yeah.
Let's manage this issue game versus when we started getting towards the tail end and we're not having any pain and we're trying to get our strength back. We're trying to get back to golf. We're trying to get back to pickleball. That's when it's going to be like, okay, let's change the dynamics of this. And now I'm going to actually attach a weight to your pickleball racket or your golf club, and you're going to swing just like you would normally. And we're going to build past what you were doing before. We're going to make this tissue more resilient so you don't have this issue pop up again. So you're kind of moving through this continuum of like you're
Yeah.
starting with high reps, low load. You want to do it as frequently as possible within reason. And then you're going to start trailing down to something that looks a little bit more like strength training, and power, which is going to be like 5 to 10 reps generally.
Yeah. Right.
And then you would really want to push past that and start training for something that you're doing, right? So if this is someone that they play 36 holes, which would be I played 2 rounds of golf on Saturday, and now my elbow hurts. And if you're going to consistently play 36 holes, we have to prepare your body for, if all those are par fours and we're playing 36 holes, you're taking 36 times 4 swings. That's a lot. So we
Yeah.
need to assess that appropriately and utilize that information for your training.
I'm sure you see people that it's kind of like their their job. Like I've seen a couple professional golfers or professional athletes where they had like this golfer's elbow.
Yeah.
How are you managing them? Are you recommending like anti-inflammatories because they have to perform, right?
Yeah. Great
And
question. So in terms of, to speak on corticosteroids for a moment,
yeah.
they can be really helpful getting you out of pinch. So let's take this professional golfer example and just say he comes to me Wednesday. He's got to go in a tournament this weekend. Yeah, and this just happened. A corticosteroid may be more beneficial at that time. Just a
Okay.
general rule of thumb, I'm sure most people know. The further out you get from the injury, so taking that example of someone taking a swing and diving into the ground, if that happened and you have that pain, if you could go straight to the doctor and get the cortisone steroid injection, that's going to be the most beneficial. As you get to a point where most people do, and unfortunately with our modern healthcare society, it's going to take you 3 to 4 weeks to get into the doctor's office, or you're going to, try and make it feel better for a week or two. You're going to realize it's not getting
Yeah.
any better. You're going to call the doctor. It's going to take 2 weeks to get in. Now you're 5 weeks out from the injury. Corticosteroid is not going to do you much good at that point. And that's just general. The further you get out from the injury, the less that steroid is going to work to quell that inflammation, the less beneficial it's going to be for you. In terms of managing someone who's like, and I've seen this with someone who worked at like a car factory, and they were getting this from like working the wrench over and over again.
Yeah.
And
Yeah.
obviously they got no choice. They got to go to work.
Right.
This is where one, you want to manage it best. I would suggest for someone like that, we'll use the mechanic for the example. Before you go to work, I need you to do a round of these 20 and to help align those fibers before you go demand of it all you're about to demand of it. And then for someone like that, I would really recommend, hey, take a lacrosse ball or percussion gun, use your hand, whatever the case may be. And intermittently, like when you're on your lunch break, whenever you can, if you're starting to have an increase in pain, you're going to perform some manual treatment to that tendon, that muscle. And we can kind of talk about that a little bit more. But in terms of how you would manage them and what I would suggest for someone who, hey, I can't just stop playing golf for the next week or whatever the case may be,
Yeah.
is the steroid, sooner the better. You want to prepare for the load without over fatiguing it. So, for instance, I said, hey, do 3 rounds of 20 of those wrist flexions before. Let's say that this is the example of that golfer and he has to go play today. I'm going to say, hey, we're going to do 1 round of 20 before you go play, and then we're going to manage it during best we can with whatever. You could do tape. There's a couple other modalities you could use to make the pain feel a little less in the moment. And then after, we also need to do another round of those eccentrics, like after you're done playing, because we need to get that collagen constantly as organized as it possibly can be. And that's the goal of these eccentric exercises. Now, I would just do just enough to get kind of a general pump going, but not so much that we're fatiguing, not so
Okay.
much that feels really demanding at that moment, because we just want to, what we're trying to do is basically stimulate the right things and wake up the right thing at the right time. but we're not trying to fatigue it, right?
Right,
In
right,
this instance.
right. That disorganization comes from just it's the overuse which creates inflammation, which creates this disorganization of the cellular matrix, right? Which then makes it swell, causes pain, eventually causes weakness. But it is ultimately when it becomes chronic, which most this is what I mostly see as you're saying also that you do. Would it be beneficial to take like a low grade anti-inflammatory, you know, on a regular basis?
When it becomes chronic like that, I don't think so.
No?
Um,
Okay.
yeah, I don't think so. Because it's become chronic like that. What happens, so specifically within your phase, and just to dial into it a little bit more, when you have that reactive tendinopathy, which again is a little bit more of the 48 hours of the golfer takes a swing and dives into the dirt and feels the
Yeah.
elbow pain.
Yeah.
At that moment, everything you're talking about is true. It's there's swelling, inflammation, an anti-inflammatory could really help, all of that stuff. Typically what I see when people get towards that more chronic issue, and you can see this in imaging even, is the tendon actually becomes thickened because it is imbibed with water, and
Okay.
it's not the quality of the cells is not the same. And it's not that we're necessarily having this constant inflammation when we get to that chronic level. It's more so that we're not even able to use this tendon appropriately because it doesn't function how it should in terms of the cells lined up the right way.
Oh,
Um,
that's really good to know. So it's more like you've kind of changed the structure. It's not so
yes,
much right, which
yes.
is it can't glide through the motion that it needs to over time. And yeah, okay.
And
So
then
yeah,
the way the tendon is kind of going to work and attach to bone is all these little fibers are going to come and attach to the bone, right? And let's just
right,
say we lose two of those middle fibers because they're not as organized. All of a sudden, that tendon is much weaker. And so
right.
you take a swing one day later and you tear you tear the flexor common tendon group off the bone, and then you have to get a repair.
So that's a
So
possibility, right? That's like that's where you could be headed
it
with
can
these
be, yeah,
things.
that's where you could be headed if you just think you're gonna you know, let this rest and you're going to work through it and so on and so forth. And that kind of leads me into treatment, Keoni, because one thing I see that has a lot of success, specifically with chronic tendon issues, is dry needling. And the
Yeah.
reason for that is, and what I think is because you're going into that thickened tissue you and I just talked about, and I'm taking a needle and going into that tendon and creating inflammation and creating injury. So then the body has that cascade of inflammation stuff that comes in and
Right, right,
helps
right,
restart this healing process and
right.
restart the ability for us to line these fibers appropriately. And that's what I feel like is most needed at that chronic stage. We actually, when we're in that chronic stage, instead of taking something to quell the inflammation, let's create more inflammation so you can heal because we've
Yeah,
gotten in a pattern where it's not
you're
working.
forcing the body to wake up to the chronic issue. So let me ask you, so with the dry needling, so you're not necessarily needling in the painful area. You're needling where the tendon attaches to the bone or,
Yeah. So I've done
okay.
both. Generally with a tendonitis, I am going to needle into that tendon. And the tendon has this very sticky feeling. It's pretty crazy. The different tissues that you go into, I'm sure you know this with a needle,
Yeah.
you
Yeah.
get different types of resistance. And a tendon has